So can you see my screen?
Not yet.
Not yet. Wait for a while.
Yeah, yeah. Now, just let me my internet is very slow. Let me
No worries, you can take few
connect
seconds.
my
After 1 or 2
internet.
minutes we can start.
Just okay. Now it's you hear me?
Yes.
Yeah. Now it's okay. Yeah.
All right, so next we're gonna start termination phase that we have discussed here. So we have bullet points here, which is examine and evaluate relationship, right? Review goals and results, and say goodbye. This is all about termination. So I will again explain termination phase. I will give you a recap so that you can understand it better. The termination phase is the final stage in the process or relationship where activities are concluded and all tasks are wrapped up, right? This phase involves reviewing outcomes, addressing any remaining issues, and formally ending the interaction of project. It ensures that everything is properly closed and that both parties are clear about the conclusions. You understand?
Yeah.
This is all about termination phase. Should I explain with examples or is it clear?
Yes. Clear. Yeah.
All right, that's fine. The next is essential and the thing we have essential and influencing variables, right? This is too much clear option. They have we have well defined over here as well. You understand about variables. So the culture, experience, copying capability, and we have psychopathology of the client combined with the culture, experience, knowledge of uh, psychotherapy and guidance skills of the nurse influence all communication, verbal and non-verbal between the two. I will try to explain in my own words, in easy words, so that you can understand it better. So essential one, well, essential variables. First of all, we have two things here to discuss: essential and influence, right? So essential variables, I will explain first. These are key factors that directly affect the outcome of a process or situation. For example, in a healthcare setting, essential variables might include the parties or might include the patient's medical history, current symptoms, and treatment plan as well. Second is influencing variables. These are factors that indirectly impact they are indirectly impact the outcome and can affect the primary variables. For example, in healthcare, influencing variables might include the patient's support system, their environment, or their level of health literacy as well. So both types of variables are important for understanding and managing complex situations effectively. Got it?
So this depends on situation or environment and this.
Yes, it depends on situation and environment. Then you will consider that in essential variables and influencing variables. Clear it now?
Okay. Not yet. The
Okay, I'll
can you?
explain in more easy words.
Okay.
You can say that essential and influencing. We have two different concepts here. Essential variable, these are the main things that directly affect the situation. For example, in a doctor's visit, essential variables are a patient's health problem and medical history. Second is influencing variables. Are addition, these are additional factors that can affect the main ones. For instance, the patient's family support for their living condition might influence their health, but are not the main health issues themselves. So both kind of variables help in understanding and managing a situation better. Is it clear
Okay.
now?
Yeah. Okay.
Next, we have an enthusiast client. How about the enthusiast client? We have few bullet points over there as well. So I will explain later on in my words as well. So anxiety can be the result of many different factors. Can interface with communication and can interface with care and treatment as well. And extreme anxiety can interface, they can interfere with comprehension, attention, and problem solving skills as well. In the last we have anxiety is contagious as well. Now I will summarize all of them in my own words, in easy words, so that you can understand it better. An anxious client is someone who feels nervous, worried, or stressed, which can affect their behavior and communication. They may show signs of uh, discomfort, such as restlessness and or difficulty focusing on, might express concerns or fear about their situation. Understanding and addressing their anxiety with empathy, clear information, and supportive communication can help ease their concerns and improve the overall interactions. It's all about the client. Got it?
Yeah.
Next, we have strategies of anxiety. We have a few strategies over there. I will I will mention few more later on, right? So strategies of anxiety. We have mild, which is mild, uh, mild, and we have increased auditory and visual perception, increased awareness of relationship, increased alternate able to problem solve, and then moderate and selective intention, decrease perceptual field, focus focus only on relevant information, muscle tension, uh, differences. There are few stages we have here. I will add few more. You can also type mild anxiety. Mild anxiety means first one is mild. Mild anxiety means characterized by slight nervousness, or you can say unease, which can help modify, which can help motivate action. Symptoms might include mild restlessness or difficulty focusing as well. How about moderate? Moderate anxiety, it involves more noticeable symptoms as increased worry, tension, and physical signs like a faster heartbeat or sweating. It may start to interfere. It may start to interfere with daily tasks as well. We can also talk about severe anxiety. It's not mentioned over there, but we can add that as well. Severe anxiety are marked by intense and overwhelming symptoms that can significantly disrupt daily life. Individuals may experience constant worry, panic attacks, and severe physical symptoms like shortness of breath or tem- or trembling as well. And we can also consider panic level anxiety. It's not available, they're not mentioned, but we can talk about panic level anxiety as well, because the highest level where anxiety is so intense that it causes severe physical and emotional reactions. This can include sudden and intense fear, feeling out of control, and experiencing extreme symptoms such as chest pain, or we have dizziness as well. So understanding strategies can help in providing appropriate support and intervention. It's all about strategies of anxieties. Got it?
No, uh, just I want to clarify for this some point here, or the, this so it means if there is uh, any case NXT,
Mhm.
uh, so this is we need to clarify for this how to remove this I mean uh, uh, confuse or any care you make relationship with the client for determinant or anything to, to remove this NXT or what? Because I see
We can
ministry
remove it, meaning I'll explain. Managing and reducing anxiety often involves a combination of strategies. So we can talk here, we can mention a few points we can consider: professional help. We can consider medication. We can consider relaxation. We can consider lifestyle changes, and also we can consider support systems, and we can consider stress management as well. I will explain one by one by one all of
I
them.
mean,
Step.
when
First of all,
patient he go to doctor, so this doctor
yeah,
should be give him I mean,
medication.
the patient, medication to I mean to remove this anesthesia
Yes,
from this patient. I mean, how
yes,
to
because in some cases, I'll let you know, in some cases, medication prescribed by a healthcare provider can help manage anxiety symptoms, right?
mm, and the focus only in uh, relevant information. What that mean?
Yes,
Only focus on
yes.
relevant information.
Relevant information means if the client has anxiety regarding the medication, the person, the doctor could consider only medication solution as
Mm,
well. But in other case, if the person has anxiety regarding stress, then we will consider another state, which is stress management, means learning to manage stress through time management, setting boundaries, and engaging in enjoyable activities can reduce anxiety, right? So it is important to tailor these approaches to individual needs and consult with healthcare professionals for personalized guidance as well. Got it?
Mm. So we have the